like a year since I did the last COVID video. If you haven't seen it, I interviewed the whole department. I interviewed nurses from X-ray to the cafeteria lady to pharmacy to lab, CNA, everybody, even the trash can guy, to see how it affects everybody. But this one is more just respiratory, and I got 4 individual. The first one is Dan, and he's a single father, a grandfather now, has grandkids, and just a regular dude. And then the second one is Wanda, single mother, has sons, has grandkids too. And then the third one is Emma. She's a respiratory student. She went to the same school I believe I did. And so that was better for me because I could see the difference. When I went to school, things were just normal. People can just get in a room and out of a room. Actually, some places people just use their hands and they were fine with it. But now you can't even breathe, So, and knowing that there's an epidemic, how do students feel? I wanted to see that perspective. And then the fourth one is Todd. By the way, Emma is married, mother, and so that was another perspective because the first 2 were single parents. And then the fourth one is Todd, single father, has 2 sons, very laid back, is into music, and he's a charge out here, so he leads, and that's what I am too, but he has more experience. All the 3 people that I've interviewed, they've been respiratory for 20 years plus. Wanda's been a traveler, so she's seen different hospitals, different cities, different stuff, and so there'd be more deeper details than me. And in this video, we explain things like this: a ventilator, this is an EKG machine, and we get into details. But for my part and my perspective, all I gotta say is I'm tired. This is day 14 for me coming in here, and no matter what I do, no matter how much I try to do things, I'm just tired, frustrated. I want to sleep. It seems like we're doing 2 years worth of work in one year. People don't get how serious this is. It's more political. It's more about if I should get the vaccine, and instead of how many people are dying, why they're dying, and what's going on. It's more, about if people want to put on a mask or not, and not understanding how fast you can spread it and what this can do to you. So people are caught up in the game and don't understand. You get people come in here, and they drop off their families, and they think, oh, I'm just gonna see you next week, and it's actually the last time. You see them. Or when they get on this machine, you usually get people off, and to be honest with you, in the last year, I only seen 3 people get off this machine. And even today, I heard somebody was getting off, but then when I was like, they're like, no, they're not getting off today. They just want to go longer because this disease really attacks you. It attacks your hemoglobin on gas exchange, and the body needs oxygen. So if you don't get that oxygen, you die. I think people need to take it more seriously. But at the same time, it's hard, right? Like I did my 14 days, and usually I can go and do something that is stress-free. But wearing a mask, being cautious, putting on these things, even at home, it never feels like you take a break, because other people get to do something else. But as a healthcare worker, everybody thinks you have the answers. Everybody comes to you as a leader, and then at the same time, everybody's scared of you because you might carry the disease. So it's really hard, but all these people, like I said, will give a different perspective of what this disease is and what it does. And please hit the like, the subscribe, the notification. If you're a healthcare worker, somebody in the front line, I appreciate your hard work, and I'm very grateful. Be careful. This is just to educate people and show people what's going on. I think it's better when you hear it from the horse's mouth. And yeah, be careful out there. Wear your mask, get your vaccination. You do whatever it takes to protect other people, because like I said, I don't feel people take it seriously. I don't feel people see how many people are dying every day. and how this thing is not easy. Seeing the families that are breaking down. You get a mom who comes in, next thing the dad is in, then next thing the daughter is in, the next thing they're all dead because they're in the same environment. And it does happen. Just because it didn't happen to you doesn't mean it's not real. Like, hit the subscribe, the notification button.
Alright, introduce yourself.
I'm Dan.
Hi, Dan. So it's been a year. The last time since we talked to you. The last time you were with Gary. Here it's really an update about so far in the last. I think it's been a year. I could be wrong. I think it's been a year, but in the last year, what have you seen out there with the corona?
What do you mean?
Like,
what have I seen?
Everybody had a idea of, well, it's something that's just passing by, or is it something that's permanent, or actually are people still passing as much? Like, anything change, rate, anything that you see that's different?
I think it's here to stay. It's like the flu. It's a virus. There's no cure.
So is it then, are you saying that people have to keep getting the shot every year?
Yeah, I would assume so, yes, because there's different strains of it they found.
And then, what's this? In your opinion, with what you've seen, do you think, does the shot work, or does it slow it down, or is it still the same?
That's to be debated, I think. Some people say it does work and it slows it down, but I don't know.
Because
hasn't been proven to me yet.
Yeah, because another thing is what I talked to about some of the people is that how do they know if you got the shot or not? Because the word around is that 90% of the people who
put it this way, a lot of the vaccinated people are still getting coronavirus. If it worked, then they wouldn't get it.
And then they're still also spreading it, right? Because they say you could still spread it. Because that's what I was going to say.
You can be a carrier.
That with this, I was saying that even if you get the shot, how do they know? Because some of these people come here unconscious already. Some of them already come in where we don't ask them these questions. So how do they know that everybody? Because they say 90%. That's what I don't get. But okay. And then what's this? I know you had your grandkids were sick. So were you worried about that?
Actually, I was.
You working in this medical field?
I was thinking it could have been me taking them, getting them sick.
So, you getting them is sick, but like, so does your family worry when you go around them because you work in this field?
Yeah, they do. At first, when it first came out, they were kind of making me like disrobe out in the garage, shoes, scrubs, go in, take a shower. Now, not so much. It just.
Do you feel do you feel weirded out or feel like it's wrong that they act like that, or you feel like they're
No,
right?
I don't. They're kids, they're the future. I would do anything to protect them, but yet again, I have to live my life. I can't just.
Yeah. So now with all that, how do you deal with it? Like, we're short, everybody's working overtime. This is still not stopping. How do you balance the two of, coming in and helping, and at the same time staying home?
Still have a home life?
Yeah.
I don't have a home life. It's all about work.
And then so let me say, do you feel bad where I know sometimes we'll call you and be like, well, we need 5 more people, and then you're tired and you're like, well, I can't come in. Do you feel like
I feel like I let the people down, my co-workers down. Yes, I do, because it's like, man, I know I'm sitting here at home with the family, and I could be in there helping them. I know they're working their butts off. I should go in and help, but I'm tired. I need a day off.
I get it. Now, do you want this to end, like, in a sense of?
Oh yeah, you want every sickness to end, but I don't think it Right now, I don't think it will. I mean, it might slow down and come, I want to say come to sort of an end, but I think it's like the flu. It's going to come back every year. You know, I mean, it's just, right now though, I don't understand why it's hitting really in the summertime.
Yeah, because that's the other thing we're discussing, that it's the summertime and we're intubating and we doing all this stuff. That
Well,
what
it's just
happens
like
when winter
with
comes.
the kids right now, with the croup and the RSV, it's hitting right now. Why? It shouldn't.
Yeah,
It's not wintertime.
that's crazy.
I have no logical answer for why, unless it changed people's immune system, maybe. You know, I mean,
Yeah.
maybe they've been exposed somehow and it messed with their immune system, and now it's, I don't know.
Okay. Now, what's the machine next to you right there?
That's called a high flow.
So, what would you use it for?
Well, usually when people come in, we usually start them off on like 2 liters of oxygen, and if they're not maintaining their SATs or whatever, we up the oxygen. Then we go to like say a simple mask or a non-rebreather. If they still can't maintain their SATs, then we put them on this. It's a high flow, it's a higher flow of oxygen to help open the alveoli, get the oxygen in quicker, I guess you want to say. More, you know, same percentage, just more of a flow. They say it causes a pressure,
Okay.
like kind of sort of like a BiPAP, but I don't see it. I mean, because the BiPAP has a mask, it's kind of a sealed
And it's
system.
sealed, yeah, it's a sealed
This
system.
is dependent on patient, you know, I mean, if you open your mouth, you lose all your oxygen out your mouth, or most of it.
So
not
would
all.
you say in your mind that's a hit and miss?
It works for, you know, I mean, on people that need a little more oxygen, yeah, it works. But for corona, where your lungs have already taken a hit, it's just a stopgap. There's a progression with corona,
Okay.
and once it starts,
There's no
it's
going
hard to
back.
stop. You can't stop it.
Well, thanks for your time, man.
Yeah.
And thank you for your
Not a problem.
sacrifice. Appreciate it.
Yeah.
Good evening.
Good evening.
How you doing?
I'm
What's your name?
Wanda Hungerford.
And what do you do?
I'm a registered respiratory therapist.
And in respiratory therapy, what do you? What's your specialty?
Neonatal pediatric.
Okay, so since COVID's happened, and it's been almost a year and a half or a year, what have you seen? What's going on?
Well, in my world, it's hit or miss because before, when it first came out, I didn't see anything hardly on my end because it's babies and moms, and it wasn't affecting them then. Now I see more moms.
Okay.
Now it's more moms. They're young moms. And I haven't had any babies yet.
And so with, I don't know, because like I said, it's only been a year. With what you guys see, I don't know the research. I'd be lying if I say I know about NICU. Does it pass from mom to child?
So far it hasn't. I haven't seen that.
Okay. So what do you do when mom has it, and then?
We separate. We make sure we get the baby separate from the mom, you know, and especially because I work in the NICU. So we bring the baby and we put the baby in isolation once it reaches NICU.
And then, so does the mom, since it's a 2-week thing, because I've noticed everybody, you know, it's the 2-week rule that, okay, after 2 weeks, if you make it that far, it's out of your system, or you have it and it stays there. So does the mom have to, you know, take the 2 weeks away from the child?
The mom actually, it's been my experience that they stay where they are quarantined in the LD room,
And then does that affect the baby's development? Because the baby just got out and it needs that
And then
mother to
it's
child
bonded and
yeah.
everything. And unfortunately, that's one of the things that may get missed, right? Unless they put the baby to mom's skin to skin after the baby was born right away.
Okay.
And other than that, when they come to the NICU, the mom can't come to the NICU, so we have to do that.
And how do they take it when you have to tell them, like, listen, you can't see, not eventually, yes, I guess they see, but you can't touch your child for that long.
I'm pretty sure they take it hard, but I think they are more concerned about what could happen, the COVID getting to their baby than them touching their baby. The safety of their baby. They're more concerned about that.
Okay, now, if you're pregnant, right, and then are they recommended to take the shot too?
Yes.
Is it safe for pregnant
Now it
women?
is. Yes, it is. With the Delta variant out right now, they want, they're telling the pregnant moms to get them. I actually had someone tell me that their daughter got it right before the baby was born and everything was fine. And she was basically like, I think 2 weeks out before delivery.
Oh, okay.
And everything came out fine.
And then
The baby and the mom.
with the moms that get it, have you seen moms get it with the shot?
I haven't, not in my experience.
Okay. So, what's this? So, do you, when you come into work, are you more relaxed because you don't see a lot of COVID, or how is it? How do you deal with it even at home when you have your grandkids, your kids going around them? How do they treat you, and how do you react to that?
Well, my family pretty much knows I'm going to keep them safe first. So that was one of the reasons why I got the vaccination. Not so much that I would catch it, but that I would catch it and give it to someone else, especially my loved ones. I mean, working in the hospital. So they knew I was keeping them safe. So they're okay with that. Otherwise, I guess it's okay.
It's okay.
Everything's going all right.
Okay, that's good. So what's the machine that we have over here next to you?
The machine we have here is the Madcat Servo I. This is the ventilator that we use on the babies.
Okay, then what are the factors that end up getting a baby intubated? Like, you know what I'm saying?
Respiratory failure, RDS, which is respiratory distress syndrome, which is basically the baby term for ACLS. I mean ACLS, ARDS. Too many letters, but too many acronyms. But yeah, so it's the equivalent to ARDS for a baby. Is RDS.
Okay, now when you intubate a baby, what determines how long they're intubated, and how do you know when to get them off?
Well, it's up to the baby. They determine it.
So every baby's different?
Yeah, every baby's different.
Okay.
And then we basically just wait for their oxygen to be able to maintain their oxygen.
After you intubate them, do you wait a couple of days where you release them, or like how do you determine, like, okay, it's safe enough for us to go, you can go home?
To go home, we would wait until the baby is able to go home without oxygen.
Okay.
We would watch the apnea episodes of the baby, because babies tend to have a lot of apnea. And we have to watch how long they have apnea and monitor that. We also have to do a car seat test.
Okay.
And the baby has to be prepared to be okay in the car seat without oxygen, without anything happening. And the parents have to be trained in putting them in the car seat.
Okay. Now here's this question I just thought about right now. Now, when you, let's say I'm up there, I have a child, right, and they're up there, and I'm a father, and the mom is there, and we don't have COVID. It seems like everything's cool. do you guys have a requirement of you have to have a shot to come up here and see the child because there's other children and other people? Or is it kind of wear a mask?
Okay, if you had COVID.
No, we don't know. So I'm saying that's what I'm saying. We don't know if I have it.
Masks. Yeah,
Okay.
everybody's
So there's
required to
no,
wear a mask.
there is no, you're required to have a shot or anything like that.
Not right now.
Okay. All right.
It's just that they have to be masked up though.
Okay.
And you have to scrub when you come in any interview, you have to scrub.
Okay. Well, thank you for your time, Miss Wanda.
I hope I help.
Yes, ma'am. Appreciate it.
Hi,
How you doing?
well, and yourself?
I'm good. What's your name?
Emma.
And what do you do?
I'm a student RT.
Okay. Now, why do you want to be an RT? What's it?
I've always liked the medical field. I don't necessarily want to do nursing, but I want a career.
Okay. Okay. So
And
you,
eventually might lead into something else, I don't know, but I do love the medical field. I've always caught myself going back to it.
okay. Now, with Corona and everything, I know when I came out as a student, I wasn't really scared about, I might catch something or die or it was just, I'm just, going to be a respiratory therapist and when I go to my clinicals, I don't have to wear super masks. I don't have to wear 700 shields. I'm not worried if I'm taking things at home because also I was married. My wife was pregnant at that time. We didn't have a kid yet, but you know what I mean? But now it's a different scene, it's a different kind of environment. So how do you feel with everything going with Corona when you came to clinicals? What were the thoughts running in your mind?
I'm not gonna lie, I was kind of nervous at first. But I kind of feel like you guys have done a good job here with, following my school's protocols and not making me go into the rooms that, I'm not supposed to go into.
Yeah.
But I mean, I've had COVID before.
How was that?
It was okay. I was tired a lot. I slept a ton, had a cough. Didn't have any fever or anything, but, I got through it.
Were you isolated?
Yes, I stayed in my room by myself, and my husband and my daughter stayed in a different room.
Okay, how did the family take that?
It was kind of hard because my daughter and my husband were really close, so keeping our space from each other, making sure that my daughter would be okay, and my husband would be okay.
How do they treat you knowing that, okay, she's going there for a future, but at the same time there's some crazy disease out there and she might bring it here, like even, I'll say, visiting your mom, your family, how does everybody kind of react to that?
They're kind of nervous, but then they also know the precautions they've been taking, and it helps ease my mom's mind that I'm also vaccinated, so I won't. If I were to bring anything back home, it wouldn't be nearly as bad.
Okay. What's this? When you started, was COVID already out?
Yes.
So that didn't change your mind of thinking maybe I should do something else?
No. It was
Okay.
kind of hard though to adjust because I'm a very visual learner. I have to be in person to
See things.
see things and hear things, and it's just easier to focus. It's been hard being online, but we recently went back. I want to say July. We started going back. My class went back at least.
So among students, were other students concerned? Did other people quit? Because this is an epidemic, so
Yeah.
I don't know.
I don't think any other students quit. Honestly, we started out with a big number. We had 24 people. Some people just quit because it wasn't their, ideal, what they would really think they're going to sell them to.
Okay.
And then other people, I just don't know if they just make the cut for a moment because, you pass all your classes. Nobody's really quit, I know, just because of COVID.
Okay. So now, do you have a niche since we don't let you get into the COVID homes? Do you have a niche to see what's going on? Do you think that would be better than you guys not seeing, being exposed to what's going on, so that when you come in and start doing what I'm doing or what your preceptor doing, or are you more like, it's okay, I don't want to be part of it?
I feel like we should be exposed to it only because, say it's going on next year. It's still just as bad. Or we would say, oh, sorry, I can't go in that room. I wasn't taught how to do this.
So you feel like it's the new norm?
For now, yes.
Okay.
I mean, it's gonna be around, from what we know, it's gonna be around for a while, so. I think it's just us learning how to, just basic hygiene care, making sure, doing your proper procedures of covering up, wearing your mask, washing your hands, proper PPE.
Now, are we in the schools? Are they requiring everybody to have the shot, or is there masks too in classes in the schools and stuff?
We did have the mask lift for I don't know, a couple weeks, and then it started becoming really big here again in Arizona, so they mandated the mask again for school. Vaccines are not mandatory right now,
Okay.
but for students at certain clinical sites, it is required.
Oh, so you can't do clinicals without getting the shot?
Not here, depending on where you're going.
Oh,
So
okay.
certain hospitals are requiring that you get a shot.
Oh, okay. Okay.
And there was actually an email sent out saying that, and then a student replied, it's illegal to make
People.
get their vaccine.
Okay, and how do you feel about that? Those who say, okay, well, as much as it's somebody's right to take it, it's also my right not to take it.
Again, I kind of feel like it, I don't know, I think it's very new, the vaccine's very new to really say it's working or not, but then at the same time, I kind of feel like if you're continuing doing your proper hygiene stuff, you'll be okay, just like anything else.
Yeah, because even Dr. Fauci himself said that even if you take the shot, you will get it, and you can spread it. So where do you draw the line to say, okay, let's say me and you are in a room, and you have the shot and I don't, and then somebody, the third person who we are around all the time gets it, how do we determine who gave it to them, and how do we determine then who's right or wrong?
Yeah, that's hard to say. It really is. You can't just pinpoint on one person and make somebody else feel bad when you definitely could have been the carrier.
Are you with what you're seeing around? Are you hopeful for the future? Is this still something you're interested in, or you're just like, you know what, I'm already here. I'm just gonna.
What do you mean, if I want to continue doing the path I'm on,
not saying you want to continue. Of course, you want to finish what you started.
But some people will just stop.
Yeah, so. And so I'm saying, are you still optimistic? Are you still thinking the future's bright, or did this kind of kill your spirit? Because like I said, I came from a time where it was just, I'm going to class, I'm helping out, you know what I'm saying, and I'm just doing what I need to do. This is totally different. It's new for you guys.
No, I'm very optimistic. I think, it will eventually get better. It may not be, everything tends to get worse before it gets better. So I feel like eventually we'll see a light towards the end, or at least they'll start lightening up. I don't know what it's going to be, whether it's going to be people being vaccinated more, or just, people being more cautious.
Okay. Well, thank you for your time. We appreciate it.
You're welcome.
Good luck for the future. What's up?
How you doing?
I'm good. What's your name?
Todd.
And what do you do?
I'm a respiratory therapist.
And in respiratory, what do you specialize in?
Getting out of work? No, not really. I do PICS. I guess that's sort of a specialty. I don't do so many of them as I used to.
Okay. What are PICS?
PIC line is a peripherally inserted cardiac catheter. It's basically an IV that runs all the way from the basilic vein into the top of the heart. It's more of a permanent IV. It lasts longer as long as it's kept clean, doesn't get infected. They can keep them in there for up to a year.
Okay, and what settings do you do they usually order PICS?
In the ICU for the most part, but there are some patients that we get them up on the second or third floors. The medical floors, the tele floors.
Since we're on the topic in the ICU, it's been a year now. The topic base is COVID. What are you seeing out there, and what has changed? If you've seen anything's changed, and what's remained the same? So it's actually a broad question.
It's sort of a flashback, really. I'm having all these memories that I had a year ago that I've tried to get out of my mind and not think about. And you could probably attest to this. Just about everybody I've seen, I say, did we do this a year ago? Why aren't we prepared for it this time? You'd think you'd learned your lessons. You got this many people that are under your charge, whoever you are that's in charge. Be it president all the way down. nothing that I can do about it. I'm doing the best I can do with what with what they're giving me. So not much has changed.
Okay. And so what are you seeing with the patients and things like that?
Maybe a little bit different population. Not so many old. There's some younger ones.
Also now it's mixed up.
It is. It's a little bit varied. I would say varied. Whereas before it was usually elderly, pre-existing conditions, and they were sick to begin with, and it just pushed them over the edge. Where I'm seeing more people that are a little bit on the younger side, saying like 40s, 50s. I'm considering young for this patient population.
Okay. And now, do you think this will ever slow down? Do you think it'll ever change? With what you've seen so far, do you think there's anything we can do better than what we're doing?
Yeah, I think history says it'll change. We haven't had something like this before where we have the medical capabilities to combat it or feel like we're combating it. I think a lot of stuff is sort of a feel-good thing. It's to make the people feel better. Rushing to get the vaccines out, and whether they did it right or they didn't do it right is not for me to tell. Everybody's got their own personal story and their own narrative they're going to tell. Some people swear on it, and some people can't stand it.
Okay. And what's this? Do you, with everybody now, in different states, we're finding out people are quitting. If it's for they got to take the shot, they're not into it, or it's the workload, or seeing people dying. Do you feel like doing something different? Are you burnt?
I would love to do something different, but I've been wanting to do something different before COVID came along. It's a fast-paced job. It's 12 hours at a time, and it's a lot of 12 hours in a row, especially with COVID around. And that just wears me out. So yeah, I would love to be doing something different. But having said that, COVID is here, and there's something I can do about it, so I can do my part. That's what I'm going to do.
And then we see people die, and for us that's normal. I've seen a couple of people get emotional and stuff, and I haven't personally, but I've seen some. And do you have an understanding of, we've seen people die so many times differently, why is it now that some people are passing and other people are emotional about it? What's the difference of somebody passing from a blood clot and now somebody passing from COVID? What's so special about those people that
they say anything about the people? You refer to the patients, so special about the patients?
Yes.
I don't think it's about the patients at that point, because you're talking about people getting emotional and getting burnt out and stuff like that. That's the people that are doing the work. That's the people that are going to be here. When this patient is gone and they've passed and their families are done crying and they've had their cookies that we've given them and they leave, we're still here. We still have patients that could be right around the corner, right behind them. You never know. Well, you kind of do know. You kind of know that it's gonna happen again. It's not like these patients can walk away from it. I'm not saying that that's easy at all. They have their family members have passed. They have to grieve and deal with that. We don't get a chance to grieve. We go on to the next, and we just keep plugging away. We got code after code after code. 3 codes in a row at night, and you don't feel like you're doing anything. That's frustrating. The first round, I should say, of COVID. The thing that got to me was people were all alone. Whether they had 10 people in the room and they're doing compressions, they're doing all that, but that person is alone. They don't have anyone that knows them, that cares for them, that loves them, and wants to tell them goodbye.
Let them come in.
Can't come in.
Yeah.
I mean, that is what it is, but that's rough. And now, I get emotional all the time. I will cry at a Hallmark commercial. I was just in a patient's room doing a redressing an arterial line, and they had their music going, and it was Christian music. And I haven't listened to Christian music in a long time. Not saying I'm not Christian, my music, my taste changes.
Yeah.
And I started welling up. It made me think about things. So
now, outside of work, being around family and friends, how do they feel being around you with this deadly virus, and at the same time, do they feel safe? Do they feel like, well, you deal with this all the time, get away from me? How is everybody reacting to you out there?
Well, I don't do a lot outside of work, unless it's with my family or my friends. The only friends I've got are doing this already, so they know what's up. They know what time it is. But I think of my mom. She asks for advice constantly, and I give it to her constantly, and she's taken it so far, which is great. So she's been vaccinated and everything, and that's what I recommended for her. And I got an 18-year-old son at home. If everybody knows what an 18-year-old son's like, they don't listen to anything you say. So I told him he should probably get the vaccine, and he's like, "No, Dad, I'm good." I'm like, "Okay, you're good now. I have to live with it after you die from COVID." So you gotta kind of put the scare into him. It still didn't work.
So you are advocate of getting the vaccine?
Not for everyone, no.
Okay.
There are people that probably should not have it, and there are people that are so against it. I wouldn't even try to talk them into it. That's not what I do. I give people the choices, or I show them what the road ahead looks like, and if they want to go down it, they can.
Okay.
I mean, I do that even with my 18-year-old son. He's a grown-ass man.
Okay. Now, we got 3 machines over here. If you mind, could you explain what each of them does, starting with this big machine right here?
Which one? This one right here.
Yes.
This is our Pure Bennett 840. It's a ventilator. So what it does is breathe for the patient. There's different modes. You can let them do most of the work. You can take all the work away from them, paralyze them, and it'll do everything for them. And just about everything in between. It's a handy little unit. It's got a lot of hours on it. It's been really getting some work out in the last year.
Okay. And is it an older version?
It is an older version. They've got a newer version. I'm not sure what happened with that. We got one of them out of, I think we got 10 at the time, and they sat, and I think they had to get something done to them. And long story short, we've only got one of those left, so we've got a bunch of older ones that we're all familiar with.
So the second one is gone. Do we have 2?
Do we have 2?
I thought we did.
Shit, you know more than me about that.
Okay.
I haven't seen but one.
And so is this what, when they said they were looking for, right? This is the same thing they said the U.S. had the shortage of the first time, right?
Yeah. Well, I think that was, and might be speaking out of turn. I think what my impression from that statement that they said several times was the projected need was going to outnumber the amount that we had out there. So at the time that they said it, there was enough, but they're on the ball and they're like, okay, we're going to get all these.
How long do especially COVID patients usually last on those ones?
That's a great question. I'm not sure I'd have an accurate answer to. I don't know if I want to answer to that, but a week minimum.
Okay.
But I mean, there's people that have been in ICU that you're just like, you go on vacation, you come back and you're like, damn, they're still here.
Yeah.
And they just don't go. They don't go.
So the lady before, Wanda, said that with her vents, it depends on the babies on when you get off. Is that the same with this, or meaning does it depend on you, or is it?
Well, the thing about the babies is babies are very resilient. They're new. They're right out of the box. They got a fresh warranty. The COVID patients, for the most part, don't. They're not doing so well.
Okay. Now, what's the one with this behind you right there on your right?
It's the money maker right here.
Why is it called the money maker?
Oh, I don't know. I call it the money maker because we do so dang many of them, and they're so easy to do. And sometimes I gotta have several of them in a day.
And what are those?
I'm sorry. This is the ECG machine. Yeah, it's not even plugged in, but yeah, it works. I think.
What does it do?
It basically gives you a visual picture, a numbered graphed picture of your heart, how it's doing as far as conduction and delay and stuff like that. So I can let you know if you had a heart attack. It can give you your heart rate. It can give you the waveforms and all that.
Okay. And right here, what do we
hell of an armrest too.
Next to it, what do we have?
That's our BiPAP. That's what we started out with, saying we can't put COVID patients on. Well, we ended up putting COVID patients on because we didn't have anything else to put them on.
So what does the BiPAP do?
BiPAP is it is a non-invasive version of this big boy over here.
What does non-invasive mean?
Non-invasive means it's not going into the body. It's like this mask is non-invasive. If I put a tube down my throat, that's invasive.
So are you saying that you're going to have a tube down your throat?
There are some of these that you don't have to. This is not one of them. Some of them have the non-invasive mode. It's a whole computer program thing you got to get that you buy. It's like an extra thing.
And then this right here is...
This one right here is just a mask.
There's
a little mask right there. It's in plastic, but basically it goes over the nose and mouth, and it uses pressure in two different ways. It helps. It's kind of like power steering. When you breathe in, it's going to help you breathe in. When you exhale, it's going to give you a little back pressure. And if you ever see anybody with COPD or older people trying to walk a flight of stairs, their lips kind of purse together, and when they blow, it gives that back pressure. It keeps the alveoli, which are the little sacs, little air sacs at the base of your lungs that have to stay expanded in order to work. They have to be open. When they close, they're harder to get open than you might realize. And that's what this helps a lot of people get over the hump. Not to be confused with the one they use at home. The one they use, this is industrial. The one they use at home is going to be nice, and it's going to have a nice soft plastic mask. This thing's miserable.
It's always what I have to tell the patients when they ask me about it, and I'm like, yeah, this one's aggressive. It's not the same.
Yeah, aggressive. That's a good one.
Yeah, it's not the same as home. So,
Not at all.
when you're a COVID patient, so do you start out with the BiPAP or are you straight ventilator? How?
Well, it depends on how they present. They can present differently. If somebody's in an emergent situation, they come in through the ER and they can't breathe on the ambulance and they're purple when they come in the door, they're probably going to get a tube right off the bat, which means they're going to be on this bad boy. If they're, you don't have to be quite as aggressive with them, they're a little bit low, they're not quite as critical, then we can start them off with this. You always want to start with the lowest modality you can, the least amount of invasive or any kind of support you want to give the least, and hopefully you'll be able to see them recover themselves where they used to be able to do. Now when you get COVID, you got an older patient population, it doesn't happen as readily. So a lot of people are just going from this to that to hello Jesus.
Oh, okay.
Yeah.
Well, we appreciate the knowledge. Thank you for your good work. Keep it going, and stay positive.
All right. You too. Wear your mask.
Hey.
Halala, halala sanbongela, halala, halala sanbongela we. Halala, halala sanbongela, halala, halala sanbongela.